Hello everyone, in this video we're going to see yellow fever virus. Introduction. Yellow fever is an acute viral hemorrhagic disease transmitted by the infected female mosquitoes. Yellow fever virus is caused arbovirus of the flavivirus genus. Also named yellow ascites causes jaundice at the later stage. Yellow in the name refers to the jaundice that affects some patients. This virus is endemic in tropical areas of Africa and South America. Yellow fever virus, also called yellow jack. About its morphology. Yellow fever virus is an arbovirus. Family Flavoviridae. Genus Flavovirus. It's an enveloped virus. It's a spherical particle 50 nanometer in diameter. And its shapes isohedral nucleocapsid symmetry. Nucleic acid contain linear positive sense single-stranded RNA. About its diagram. Envelope protein. Envelope protein involves in the multiple process of virus life cycles. Envelope. Envelope is the outermost layer of the virus. Viral genome. Viral genome contains single-stranded positive sense RNA. Nucleocapsid. Nucleocapsid is governed by genetic material. And viral tegument. The tegument is space between the nucleocapsid and the envelope. Typing. Yellow fever virus contains 7 genotypes as been identified based on genomic sequence. 2 genotypes is identified in South America and 5 genotypes identified in Africa. 5 genotypes are in first one, the West African genotype 1. Second one, West African genotype 2. Third one, East and Central African genotype. Fourth one, East African genotype. Fifth one, Anglo genotype. Transmission. It's transmitted by the female mosquitoes belonging to the Aedes and Haemococcus species. 3 types of transmission cycle occurs. First one, Slavic jungle yellow fever. Second one, intermediate yellow fever. Third one, urban yellow fever. First one, Slavic jungle cycle. Its reservoir is non-human primates monkey. Its vector, forest mosquitoes. Haemococcus spegazzini in the South America. Aedes africanus in Africa causes this infection. Probably humans or visiting or working in the jungle may have been infected by this species. Second one, intermediate yellow cycle. Reservoir is a human working in this forest will be affected. Vector causes infection by the forest mosquitoes. Aedes africanus in Africa causes infection. The virus can be transmitted from monkeys to humans or from humans to humans via mosquitoes. Third one, the urban cycle involves its reservoir is human. Vector is urban mosquitoes Aedes aegypti. Virus brought to the urban settings by viremic human who was infected in the jungle or savannah were infected by these organisms. Transmission cycle. Jungle Slavic cycle, non-human primates infects this mosquito and mosquitoes to infect non-human primates. The infected humans will go to this urban cycle. Humans will infected to the mosquitoes and mosquitoes causes infection to these humans. Third cycle is the intermediate cycle. It's a non-human or human primate were infected and the mosquitoes will bite to this infected humans, they get this disease. And infected mosquitoes will bite to these uninfected humans and causes infections. It's a 3 types of life cycle occurs. Clinical features. Incubation period of yellow fever virus is 3 to 6 days. It causes 2 types, acute phase and chronic phase. In acute phase causes headaches, muscle aches, joint aches, fever, flushing, a loss of appetite, shivers, backaches. An acute phase may disappear for up to 24 hours. Second one, toxic phase. Decreased urination, abdominal pain, vomiting, heart rhythm problem, seizures, delirium, bleeding from the nose, mouth and eyes. Chronic phases, it affects the liver. Next, diagnosis. Blood test is detection of this virus, and serological tests like ELISA, immunofluorescence test. ELISA is an enzyme-linked immunosorbent assay. It mainly detects the virus-specific IgM and utilizing the antibodies. And next diagnosis is PCR, polymerase chain reaction. Next, how it will be management. Yellow fever virus is managed by only the vaccines. Yellow fever is prevented by an extremely effective vaccines, which is safe and affordable. A single dose of yellow fever vaccine is sufficient to against the yellow fever disease. A booster dose of the vaccine is not needed. The jungle yellow fever control is difficult, but using 17D vaccine is only the control measure of this fever virus. Urban yellow fever virus is controlled by the vaccination, vector control and surveillance. Vaccination is a rapid immunization of the controlling measures of yellow fever. Vector control is the objectives to reduce the rapid vector population by stopping this transmission quickly. Surveillance is a program of clinical, serological, histological and entomological. Treatment of yellow fever virus is providing fluids, replacing loss of blood, kidney dialysis if there is kidney failure occurs. Some patients may need a plasma. The patient should be kept away from these mosquitoes. A single lifetime dose of yellow fever vaccine is sufficient. Booster additional dose for high risk group of people which leads to death, they may need a booster dose. Treating any secondary infection causes vaccines is needed for their survival. Making sure the patient blood pressure is adequate. These are the treatment for prevent the yellow fever virus. Thank you.